Imagine the human body as an orchestra, with each organ playing its unique part. The heart, the tireless conductor, beats rhythmically, propelling life-giving blood throughout the body. This listening technique, known as auscultation, is a fundamental skill in medicine, using a simple instrument called a stethoscope to unlock the secrets held within the chest. Auscultation is more than just listening. It's about interpreting the sounds, recognizing patterns, and identifying abnormalities. With each heartbeat, the heart valves open and close, creating distinct sounds that paint a picture of the heart's function. Like a detective piecing together clues, a healthcare provider uses auscultation to diagnose and monitor various heart conditions. From the bustling emergency room to the quiet confines of a family doctor's office, the stethoscope remains an indispensable tool in the medical profession. By mastering the art of auscultation, healthcare providers can provide timely and accurate diagnoses, ensuring the best possible outcomes for their patients. The heart, a tireless muscle, pumps blood throughout our body, supplying oxygen and nutrients essential for life. To ensure it's functioning correctly, doctors use a stethoscope to listen to the heart sounds, a process called auscultation. The primary purpose of heart auscultation is to evaluate the heart's rhythm and sounds. By listening to the distinct sounds produced by the heart valves opening and closing, healthcare professionals can assess the heart rate, rhythm regularity, and the presence of any unusual sounds. These sounds, like clues in a detective novel, can reveal a lot about the heart's health. Beyond assessing heart sounds, auscultation plays a crucial role in diagnosing a wide range of cardiac abnormalities. From heart murmurs, which are extra sounds caused by turbulent blood flow, to abnormal heart rhythms, auscultation helps detect early signs of heart disease. Heart auscultation is a non-invasive, safe, and painless procedure, making it an essential part of any routine physical examination. By listening attentively to the heart's rhythm, healthcare providers can gain valuable insights into the cardiovascular system's health, allowing for early detection, diagnosis, and management of potential problems. Imagine the human chest as a treasure map, and the key to unlocking its secrets lies in knowing the precise locations to listen. These locations, known as auscultation landmarks, are specific areas on the chest wall where the sounds of the heart valves are best heard. Think of them as listening posts strategically placed to capture the heart's symphony. There are 4 primary auscultation landmarks: the aortic, pulmonic, tricuspid, and mitral areas. Each landmark corresponds to a specific heart valve and provides valuable information about that valve's function. Just like tuning into different radio stations, listening at each landmark allows us to hear distinct sounds and assess the health of each valve. Aortic area, located on the right side of the chest, in the second intercostal space, just beside the breastbone. This is where the sound of the aortic valve closing is heard most clearly. Pulmonic area, situated on the left side of the chest, mirroring the aortic area. It's in the second intercostal space just beside the breastbone, and is the best location to hear the pulmonic valve closing. Tricuspid area, positioned slightly lower on the left side of the chest, near the bottom of the breastbone, typically in the 5th intercostal space. This landmark allows us to hear the tricuspid valve closing. Mitral area, found on the left side of the chest below the nipple in the 5th intercostal space, closer to the armpit than the tricuspid area. The heart, a rhythmic drummer, beats steadily, producing sounds that reflect its health. Normal heart sounds are like a well-rehearsed melody, while abnormal sounds are like discordant notes. 2 main sounds characterize a normal heartbeat, S1 and S2, often described as lub-dub. These sounds are produced by the closing of heart valves. Murmurs are extra whooshing sounds caused by turbulent blood flow within the heart. Section 5. Mastering the art steps for effective heart auscultation. Heart auscultation, a cornerstone of cardiovascular assessment, is both an art and a science. It's not merely about listening, it's about listening effectively, using a systematic approach to capture the heart's subtle sounds. Effective heart auscultation involves a series of steps designed to ensure accuracy and thoroughness. First, positioning. Begin by positioning the patient comfortably, either sitting upright or lying down. A quiet environment is essential to minimize distractions. Second, technique. Hold the stethoscope's diaphragm, the flat side, firmly against the patient's chest wall at each landmark, ensuring a good seal to capture the sounds clearly. Third, systematic approach. Listen at each of the 4 key landmarks in a systematic order: aortic, pulmonic, tricuspid, and mitral areas. This ensures that no area is missed and allows for direct comparison of sounds. By following these steps meticulously, healthcare providers can ensure a comprehensive and accurate assessment of the heart's rhythm and sounds. Section 6. Insider Secrets. Clinical Tips for Accurate Auscultation. Mastering heart auscultation, like any skill, requires practice, patience, and attention to detail. While the basic steps provide a framework, certain clinical tips and tricks can enhance your listening skills and help you uncover subtle clues hidden within the heart's rhythm. Minimize distractions. A quiet environment is crucial for effective auscultation. Turn off any unnecessary equipment, draw the curtains, and ask family members to step out momentarily. Every subtle sound matters. Focus on the patient. While listening, pay attention to the patient's breathing. Ask them to breathe normally or hold their breath briefly to differentiate between heart and lung sounds. Vary your pressure. Adjust the pressure of the stethoscope on the chest wall. Sometimes a lighter touch can pick up high-pitched sounds, while firmer pressure can accentuate lower-pitched sounds. Listen systematically. Don't rush the process. Spend adequate time at each landmark, listening for both normal and abnormal sounds. Use a consistent pattern to avoid missing any areas. Practice makes perfect. The more you practice auscultation, the better you'll become at recognizing normal and abnormal sounds. Section 7. The bigger picture correlating auscultation with other findings. Imagine a detective solving a case. They wouldn't rely on a single clue, but would piece together evidence from various sources. Similarly, heart auscultation, while valuable, is most meaningful when interpreted alongside other clinical findings. A comprehensive cardiovascular assessment involves integrating auscultation findings with information gathered from the patient's history, physical examination, and other diagnostic tests. This holistic approach ensures an accurate diagnosis and guides treatment decisions. Patient history. Understanding the patient's symptoms, medical history, family history, and lifestyle habits provides crucial context for interpreting auscultation findings. Physical examination. Observing the patient's general appearance, checking their blood pressure and pulse, and examining their extremities for signs of fluid retention can provide valuable clues about their cardiovascular health. Diagnostic tests. Electrocardiogram, echocardiogram, and chest X-ray are valuable tools that can confirm or refute auscultation findings. These tests provide visual and electrical representations of the heart's activity, offering a more detailed view of its structure and function. By correlating auscultation findings with other clinical data, healthcare providers can make informed decisions about further investigations, treatment options, and follow-up care. Section 8. Beyond the stethoscope, the enduring value of auscultation. In an era of advanced medical technology, where sophisticated imaging techniques and laboratory tests dominate the diagnostic landscape, one might wonder about the continued relevance of a simple tool like the stethoscope. However, heart auscultation, a cornerstone of medical practice for centuries, remains an indispensable skill with enduring value in modern healthcare. While technology has undoubtedly revolutionized medicine, auscultation offers distinct advantages that cannot be replicated by machines alone. It's a portable, cost-effective, and non-invasive technique that provides immediate feedback about the heart's function. This immediacy is crucial in emergency situations, allowing healthcare providers to make rapid assessments and initiate life-saving interventions. Moreover, auscultation fosters a deeper connection between the patient and the healthcare provider. Despite the advancements in medical technology, heart auscultation remains an essential skill for healthcare providers. Section 9. A lifelong skill. The importance of continuous learning. Just like a musician who continuously refines their craft, healthcare professionals must approach heart auscultation as a lifelong learning journey. Continuous learning in auscultation involves staying updated on the latest research, attending workshops and conferences, and seeking mentorship from experienced practitioners. It's about embracing new technologies that complement our skills, such as electronic stethoscopes with amplified sounds and noise cancellation features. Equally important is the practice of self-reflection. After each patient encounter, take a moment to reflect on your auscultation technique, the accuracy of your assessment, and any areas for improvement. The journey of mastering heart auscultation is a testament to the dedication and passion of healthcare professionals.